Hello, I'm Dr. Rachelle Randall. I'm one of the primary foot and ankle surgeons at Lake Huron Hospital and owner of Foot and Ankle Institute of Sports Medicine here in Port Huron. Today I want to talk to you about your foot health. Our feet take us everywhere we go, but they're easily one of the most neglected areas of the body. People usually wait until things are too bad before seeking help on many preventable conditions. Here at Foot and Ankle Institute, we perform multiple different types of foot screenings and evaluate for all types of foot and ankle conditions. Diabetics are specifically at higher risk for foot infections and conditions secondary to their delayed healing potential and their likelihood of having something called neuropathy. Neuropathy is any form of numbness, burning, or tingling in the feet that usually starts at night and in their toes. Due to their high-risk status, diabetics are my #1 most recommended screening. A diabetic doesn't have to have something per se wrong in order to have their feet evaluated. Just by being diabetic, you qualify to have a foot screening to assess for any blood flow, nerve, skin, or bone conditions. Secondarily, I recommend my pediatric patients be evaluated for any concerns that their parents have while the child is still growing. By catching these different ailments earlier in life, many things are able to be corrected prior to them becoming larger issues once those bones have solidified. Some common issues would be growth plate injuries, flat feet with a collapsing arch, or ingrown toenails that can lead to infection. Next up would be my athletes. Athletes should be seen for their foot and ankle stability assessment to prevent injury. I truly feel as though everyone is an athlete. When I say athletes, I'm discussing everyone from your high school volleyball player to your Birchwood Mall walker. We have plenty of patients that play pickleball at the YMCA and need shoe gear recommendations, or are mothers chasing their kids around in sandals. We're all athletes in our own way. Some things that these patients are being assessed for is any abnormalities that would require orthotics in their shoes, as well as shoe gear recommendations. Orthotics are a custom-made arch that can help align the foot, and it stabilizes the foot and ankle joints. Having the foot in proper alignment does allow for patients to prevent future pain or injury, and prevention is the key to healthy living. Lastly, we perform gait exams on all of our patients, but more specifically the elderly patients that have concerns for fall. We assess your gait to see what can be done for stabilization of the foot and ankle, and also what assistive devices you might need in order to be most beneficial and keep that patient moving safely. Here at Foot and Ankle Institute of Sports Medicine, we want to keep you on your feet. Call my office to schedule a foot exam at 810-987-9871 and continue to live healthy with Lake Huron. Thank you.